Continuing our sleep conversation this week, we have obstructive sleep apnea, or OSA. When it comes to OSA, for those who don't know, the airways are constricted in the individual, resulting in reduced airflow, especially at night when trying to sleep. And from the outside, this usually causes snoring, which can disrupt someone else's sleep as well. In terms of cognitive and emotional issues, we do see cognitive decline from the lack of sleep, resulting in statistically higher accident rates, for example, when driving a car. Emotionally, we also see a relationship to depression and anxiety being comorbid with OSA. But here is where it gets kind of interesting. That relationship, especially when it comes to depression, is not clearly causal. Some studies show that treating the apnea improves depression, whereas others don't. And some of the theories here are that likely there's a third underlying factor causing both, at least for some people. One theory is serotonin levels, because those are implicated in depression. That's where those medications like SSRIs come in. But also, serotonin is one of the neurotransmitters mediating airway constriction. So the argument would be serotonin changes could be causing both issues. And that's why just treating one would not fix the other. We also have other theories like inflammatory disorders, because we do see a relationship between inflammation and apnea, right? More inflammation, close that airway, and depression, and even heart issues. So that makes it less clear, even something that seemed so clear that sleep apnea and reducing oxygen would put pressure on the heart and cause cardiovascular problems. But we have a different potential pathway that could just be causing both, and the apnea might not be causing it at all. Finally, when it comes to treating the apnea, putting on one of those CPAP machines, the Darth Vader mask that some people use, that can improve the airflow, but in some cases also lead to anxiety, especially related to feeling claustrophobic. You got this giant thing on your face. And so, all of that to say is that this is actually an extremely complicated subject with lots of different interconnects where probably each person's situation will be a little bit different. But regardless, they are going to be struggling with both this physiological breathing issue and the emotional issues of depression and or anxiety and potential cognitive issues from that lack of sleep. And all of that together means understand that they're going through a lot, and that when the treatment itself might cause more other difficulties, at least have some empathy for how hard this might be to resolve. As always, please follow, like, and continue to comment, and thank you.